The first thing to emphasize is that chiropractic is a distinct branch of the healing arts. You are the second largest healing profession. Homeopathic with the body. The philosophy and practice of chiropractic.
This college started in 1907. D.D. Palmer, who was the father of chiropractic, was the founder of the original school.
Okay, so to answer your question, sure.
To the early chiropractic college, we had people come who had backgrounds in manipulation from European traditions. By that we mean they were people who taught manipulation, but also taught hydrotherapy, electrotherapy, diet, nutrition, general health care.
The patient may complain of.
Western States is unique from the standpoint that it grew up pretty much by itself and developed a concept of chiropractic that was largely driven by the needs of the state of Oregon. And a lot of times the graduate of the Western States College would go into a farming community where there would be no other physician around for sometimes 50 or 60, 70 miles. And so they had to be a physician to everyone.
And as the early schools started, many of them were broad scope schools.
Anything where you're utilizing the muscle tissue.
Western States has always had that tradition.
It becomes fatigued at some point. It builds up waste products.
We also developed our own attitude about what constituted chiropractic practice.
And can you describe the pain that you're feeling?
So it's a very broad concept, much closer to the general physician role.
I think in that respect, chiropractors have pioneered many of those concepts. I think that everybody has to realize that you treat the whole person. I think the thing that's really different in the school is that we are small, that we aren't as big as some of the other chiropractic colleges, and we still have a lot of kind of one-on-one interaction.
I started out at another school, at another chiropractic college, and I didn't like that school. I didn't feel like I was getting a good education. And so I started asking around, and I came up with a couple of good schools as choices, but I found out that here in Portland it was cheaper to live than a lot of other places, and it had a really good reputation, and I found that to be true when I came here.
Just the area that the school is in is real active. There's so much going on in Portland. And I become a part of the city. I become a part of Portland.
It's a small place, it's a comfortable place, and that was one of the reasons why I came here. The other reason, I think, is the reason why a lot of people come to this area, and that is that it's in the Northwest.
Western States is a very good school. And I had met several local chiropractors here, and they were WSCC graduates, and they were really pleased with the quality of education they'd received. And it was affordable. And the Northwest is an affordable place to be.
And that's where chiropractic comes from. The practical comes from Greece, chiro meaning hands, practic meaning practical. It's the practical use of your hands. You're going to meet a lot of interesting...
You know, you start out in this class of 100+ people, and it's a very diverse crowd. We have people who are, you know, in their 40s, and it's their second or third career, and then we have people who are right out of junior college, and they're barely 19 or 20. And they're all going to grow up to be doctors in this school.
I'm referring you to my colleague.
We have students that come from chiropractic families. We have people with PhDs in the humanities and in the sciences, broad professional backgrounds in other disciplines altogether. Students that have come to us after successful care in chiropractic and have seen what it can do and have said to themselves in some fashion or other that I want to be a part of that.
What I really wanted to do was to help the body to heal itself and to be able to work with people on every level and teaching them how to take care of themselves and to get healthy again. so I decided that I wanted to look for a real program of study where I could become a professional and become grounded enough in anatomy and physiology and all the basics that I could really trust my knowledge.
The neurologist suggests that likely...
The first 2 years of the curriculum are basic science courses, which is a foundation in science.
It's a very broad and in-depth program. Our students are in class probably 30 to 35 hours a week just in learning the basic sciences. It's a very demanding program, particularly during the first 2 years.
Remember this specimen we looked at earlier? We carved away part of the...
In the basic science program, we try and describe the human being from the ground up. We start at the molecular level and we go all the way through to the anatomical level.
The other day, we described how the lateral sulcus...
From the anatomical sciences to the physiological sciences to the public health kinds of issues. All of those things are covered in the program.
Superior temporal gyrus.
It's fairly tough stuff. There are components of the basic anatomical sciences and physiological sciences that are quite difficult, quite challenging. And the most difficult, most challenging part of a curriculum in the healing arts is to integrate it. And that's where we try our hardest and we spend a great deal of our time. I would stack our basic science program to any other basic science program in the country.
What do you think the etiology would be in a condition like this? Maybe I've already mentioned.
The outstanding thing about the faculty here is its longevity. People come here and they start working here and they don't want to leave. That's unusual for a college. I think it's very unusual for a chiropractic college. It's a very big plus for us. If they've been here long enough, they understand chiropractic more because they've been around it more. And their classes get much more geared toward what is needed for clinical practice.
The basic science faculty has identified the subject matter which is most appropriate to the chiropractic education, and there has been an ongoing integration process between the basic science curriculum, the clinical sciences, and the chiropractic sciences.
But if you were to go in, for example, and look at the cytoarchitecture,
we have happened upon a very unique system, a very unique combination of individuals. All of these individuals are dedicated to quality, quality first.
The clinical faculty and the basic science faculty work very strongly together as a team, and there's a lot of communication between them. And what that ends up producing is a lot of integration of clinical subjects into the basic sciences. So when you're learning about something, they'll tie it into something that you'll be learning later on, which just makes it more holistic and also makes it a lot more interesting. And you're more likely to study it and remember it just on a practical level. You know, when you're going to school 35 hours a week, you have to count on things like that to keep you going.
The third and fourth year, we combine the clinical and the chiropractic sciences. That's when students learn manipulation. They learn technique. They learn biomechanics.
However, sometimes people have an extreme drop.
It's up to, I think, people like me to bring to students the understanding that they have to do the correlating, the integrating, and they have to now take all those pieces and make them fit their own personality and their own self.
Put your thumbs on it, turn it.
That even though we specialize, in quotes, in musculoskeletal disease, we are a primary care physician. We're a general contractor. We're providing a whole health service to the patient we treat.
At first you're learning the basic sciences, and then you start to get into some of the clinical classes, and you start to get into clinic, first treating your fellow students, and then later on treating the public. And what starts to happen is that it sinks in how responsible you are for another person's health.
I would like to welcome each and every one of you to the beginning of your experience as an intern at Western States Chiropractic College. You're at a point now where you're beginning a transition from a student to a physician, to a caregiver, and that you have got to make this transition.
I have a patient who's 4, and I have a patient who's 67, you know. And these are the x-rays of your neck. And that makes it real interesting here, because we get such a variety of people. So the middle of the back and the cervicals are your neck. This is the color. I get my hands into everything more, and that's what I liked about it. I was like, okay.
Just this last year that came together for me. I didn't really feel that confidence when I was in the junior clinic. Although that was a very valuable experience, it sort of prepared me as much as you can be prepared for coming up here to the senior clinic. But working on real patients is where I realized that most of my diagnostic skills were right on the mark.
Resist? Good. That's part of the evolution, I think. You need to confront those fears. Looking to see if you're... And those self-doubts that you have. And you confront it and you work through them, and then you go beyond it. You emerge triumphant. It's very difficult, but very rewarding. It teaches you to be a good student.
They get really frustrated, and as they get frustrated, which is limbic system, somehow, that even makes... We said that the inferior parietal lobule...
It's the basic science side of it. There's the clinical science side of it. And the two are sometimes not necessarily the same. We try and collapse the two together, and that's the goal of any healing art, is to bring the science and the art together.
It's definitely worth it. Definitely worth it. I mean, I could have gone without doing this, but I didn't succumb to those doubts and just went for it, and I'm really glad I did. Now I'm my own boss.
Optimum education is the bottom line at this institution, to give the best that we possibly can, and everything is dedicated to that end.
We stimulate our students to develop as a human being and as a person, to seek out their own interests, their own abilities, and to become a thinking individual, to become a person who has to analyze and synthesize, to accept responsibility, and to be a leader.